Twice a year in April and October, the U.S. Drug Enforcement Administration, the DEA, sponsors the National Prescription Drug Take-Back Day. The first one of this year is coming up. It's April 24th. Dr. Tara Bryant from VIVA Health joins us on Studio 10 to tell us all about it. Dr. Bryant, good morning.
Good morning. Thanks for having me.
Well, thanks for being here. Let's talk a little bit about the purpose of this program.
Yeah, so I think importantly, it's a program that provides a safe, easy, and anonymous way for people to dispose of prescription drugs. It's important because prescription drugs that don't get taken as directed can get lost, stolen, or misused. And millions of Americans actually misuse prescription drugs, and they usually find those or get those from a home medicine cabinet or a family member. So super important to dispose of medications that have that potential to be in the wrong hands.
And it seems to be there's a really good chance if you open up your medicine cabinet or your drawer or wherever that you will find some leftover medication in your home. Are there any potential reasons for that?
Yeah, I think, oftentimes a provider will prescribe something and maybe that medication didn't work and you'll move on to a different brand. But then there are times when you have a dental procedure or you have an infection and we don't always take all the medications that were prescribed. So those are ones that potentially could be misused. And we also tend to forget to take those medications we're supposed to take daily. So those get sort of piled up as well.
So on that note, any tips on how to remember to take your medications, especially those ones that should be taken every day?
Yeah, there are a couple of things. And I think most importantly, trying to take your medication alongside something you do each day, if that's brushing your teeth or preparing your dinner, if it's a nighttime medication. You can also set a reminder on your phone or put a sticker or a little Post-it note on your refrigerator or your mirror. Importantly, other things is using a pill pack where it has all the days of the week and fill that on a Sunday, and then you have those there for the week. Another thing that some people do is when they take their medication during the day, they turn that bottle over, and so it's upside down as a reminder that you've already taken that. And then before bed, to go ahead and turn those bottles right side up as an indicator for the next morning to start over.
All right, so if someone's watching this and they're thinking, I've got some medications in my home, what should they do about it?
Well, the most important thing is that you need to, if you have medications in your home that are potentially those that could get in the wrong hands, you want to keep them in a safe place, most importantly, keeping them out of reach of children, but also visitors to your home. You sometimes don't know who's coming in your home, and it could even be a friend of a friend or a friend of a grandchild or a friend of your own child. So you want to make sure they're in a safe place. But if you do find that you have medications that you need to dispose of, police stations, fire stations will participate year-round. But during this National Take-Back Day, there are many more opportunities to be able to dispose of those medications safely. There's actually a website called takebackday.dea.gov, and you can put in your zip code, which will help you know where you could potentially take those medications. I think for your viewers, it's important that it's anonymous and it's safe, and it's really the best way that we can rid ourselves of those unnecessary medications in our cabinet or our home that could get in the hands of the wrong people.
I do have one final question. Sometimes the medication someone takes may be personal in nature or they don't want to talk about it. This is a no questions asked drop off, correct?
Yes, it is. And the DEA has made that really clear. It's an anonymous way. And if an individual doesn't want to go to that website, the police stations are always available to take those medications. Again, they're not going to log that. They're not going to ask who you are. So that's another way that an individual can feel confident that that medication will be disposed of safely and that their name should not be attached to that.
April 24th, a safe, effective way to get rid of your unwanted extra prescription medication. You can find the link to the website on ours, the Studio 10 tab at fox10tv.com. Dr. Bryant with VIVA Health, thank you so much.
My pleasure. Thank you.